Good day. My name is Michael Molondo, and I'm going to present on the subject of Health Education 3 for the Higher Diploma third year. There are 8 assignments which you have to complete, and the purpose of this presentation is to give you a guideline how you're supposed to do the assignment and what's needed. The first assignment is analysis, which you have to do, where you have to look at adherence. Why adherence is very important when it comes to ARV treatment. The second assignment is then looking at ARV treatment and how ARV treatment is then monitored, and then also how it is then implemented when it comes to people living with HIV/AIDS. Then the third one is assignment is to look at the ANC, or the Sentinel survey that was done in the past in 1992, 2010, and so on. And then you have to discuss all of these reports, Sentinel reports, and then compare them, and then also look at how different are they. Was there any improvement in addressing HIV/AIDS according to the surveys? Was there challenges, and what are these? So just discuss that in details. Then of course the fourth assignment is you're going to look at ARV itself. What is ARVs? And you're going to discuss the 4 groups of ARVs, and then also looking at the benefits of using them. Then the fifth assignment is you are going to look at the differences of HIV-1. What is the difference between HIV-1? What is HIV-2? So you're going to look at the 2 different viral strain, or the strain of the HIV virus. The sixth assignment, you are going to look at positive living, what it means to live positive. Although you are HIV positive, does not mean that you don't need to have a positive lifestyle. So in this assignment, you have to come up with practical example about what it means to live positive. What is positive living? How can you live positive? So you can give a list of example of people that are living with a disease. And then of course the 7th assignment, you are going to look at the relationship of ARVs and the different phases that an HIV virus is going through when it infects a human cell. And then of course the last one, you're going to look at PrEP, or PEP, which is the post-exposure prophylaxis, which is very much more important, especially for those that are infected with HIV/AIDS. Now the first thing is assignment is it's adherence. You first need to explain what is adherence. And then secondly is you have to discuss what are the certain implications or complications that you can experience. And then you look at the different factors of adherence. And then of course in your assignment you can discuss what are the benefits of this adherence. Now at adherence, what it actually means that a patient complies to the medical instruction that's given to him. And this is where the patient doctor service provider is very important, because the patient needs to be in close contact with the doctor or with the service provider in order to look whether the patient did comply or did not default to the. And it's very important to do this, because at the end of the day, you want to make sure that the patient is actually using the drugs, or it's adhering to the drugs. And then of course the other thing is you're going to look at the factors of adherence, the relationship, as I said, between the patients and the provider. Because if you don't adhere to the principle of adherence, then you might have issues of drug resistance, where the patient might resist to that specific drug. And even if the patient is on the first regimen or the second regimen, drug resistance might be very complicated when it comes to the lack of adherence. And of course the benefits of adherence, you also discussed it in detail in your assignment. What are the advantages of using adherence, and how adherence can actually help a patient. Then the second assignment that you're going to do is you are going to look at where you have been asked to explain to your classmate or your fellow student on ARV treatment, you are going to look at the successes, you're going to look at the failures, and then of course you're also going to look at the different ways how they monitor ARV, both biologically and then also clinically. So when it means clinically, which means in a laboratory, through testing of the blood, and then biologically looking at the body of the person, looking at symptoms and all of that. So monitoring is very important. So the use of ARV became very popular in the 1990s, especially after the detection of HIV. And then it actually helped to reduce the AIDS mortality or the death of AIDS very tremendously. And it also helped then through the research or the development of research that many vaccines were developed, and so those vaccines actually helped with the treatment of HIV, and then which is still very popular up to now. Now the issue of monitoring is very important, as I've discussed earlier. Now, how do they monitor? There are different ways how they monitor when they put people on ARV treatment. The first monitoring way is what they call baseline diagnosis or ongoing clinical monitoring. The other one is also where they look at toxicity. Now, toxicity is something which is very important, and especially when you have an issue where the ARV become a toxin or the reverse within the system of the client or the patient. So this is very important. Then we've got the other way of monitoring the ARV treatment is what we call the laboratory monitoring. And then also the other monitoring is looking at the side effects. If a client is on ARV and there are certain side effects, that's also where how they can also monitor. And another way, of course, is the resistance to ARV, where you have then the drug resistance within the patient. So you have to discuss this in your assignment. Now, the third assignment is looking at the different sentinel survey, and it would be very good if you start with 1992, and then you can look at the last sentinel survey in 2014. Now, the sentinel survey only takes the antenatal clinics, information, ANC as we call it, and they use the data in order to project what are the trends on the HIV infection and people living with HIV, and also looking at the mortality or the death of HIV/AIDS. So when you look at 1992, while back, and you look now at 2014, so you have to compare those different sentinel survey and discuss it in detail. When you look at the trends, was there an increase in the HIV prevalence, or was there a decrease? And when you look where there was an increase, give reasons why were the increase in 2010, for an example. Why was there a decrease in 2009, for an example? So these are the aspects we have to discuss. Now, when you look at the 2014 census, it gives you a number of prevalence or statistics. So this is what you have to bring out in your assignment. And then, of course, also look at, now currently when we look at the HIV, according to the prevalence, it has declined from 18% to 16%. In your discussion, you have to give example why. Give a reason. Why is there a decline? Is it positive decline? Is it a negative decline? And what is expected? And of course, even if you look, people living with HIV from over 200,000 to 100 currently that are on ARV. So these are some. So discuss in the light of the recent prevalences, the decline and the increase. And as I say, you have to give a reason. Reasons for your so there is also a very good guideline that you can look at as a source. It was published last year, 2016. It's a 4th edition on the National Guideline for Antiretroviral Therapy. It also addressed some of these aspects or these issues which we have just mentioned in the first assignments, actually for the last 3 assignments. So you can also discuss it in especially assignment 1 and 2. will also benefit from this publication. So look at that publication and read through it, and you can use it as a source. So when we look at Namibia and ARV, it's quite an issue, and as you know by now, there is a difference between HIV and AIDS. So when we look at AIDS, the syndrome, which is currently it's much manageable. Now the question is it really manageable? And for how long is it manageable when we talk about AIDS? And when we look about adherence and we talk about counseling, and how do we intensify adherence counseling in Namibia? And then you can also come look at the World Health Organization Treat for All policy, where it actually said that once you have been detected that you are HIV, that you must immediately be put on ART. So these are some of the things that you can bring out in your assignment. Now, when we look at assignment number 5, it actually just look at the strain of the two HIV viruses, which are quite popular in the world. So the two type of HIV, the HIV virus is type 1 and type 2. Now, they just differ in the genomic structure, but at the end of the day, they are quite fatal. So, no, just in a very synopsis, just to give you the example of the difference, HIV-1 was one of the virus which the strain of the HIV-1 was identified already in the 80s. It's one of the most well-known virus in the whole world. In the 80s, when it was evaluated, it became one of the most popular viruses, and up to now it's still prevalent globally. And now when we look at that, and this HIV virus strain is very fatal, and it is the one that's actually found in sub-Saharan Africa and also in Namibia. Now the HIV-2 is not very common, it's uncommon, but you find it mostly in West Africa. Now, in your discussion, in your assignment, you will see I asked the question why. You have to discuss why is HIV-1 more prevalent in sub-Saharan Africa and HIV-2 more prevalent in West Africa. Then you have to give me some factual information. Why? And when you look at HIV-2 in West Africa, the levels of viral load, it's quite low, and it's less infectious than the HIV-1, which is in sub-Saharan Africa. So you have to discuss it in your assignment. You have to discuss the detail, give some factual information, and you have to differentiate with practical example. Now, assignment 6 is looking at positively living. Why do people live positively? How can you live positively with HIV/AIDS? Very important. Although you are HIV positive, there are certain things that you have to do to have a positive outlook, your mindset, your mentality you have. And there are different things that you can do to live positively with the virus. The first thing is you have to accept your status. The second thing, after accepting your status, you have to disclose your status to those that you trust, your loved ones, where if you are in a relationship, your spouse, your partner, your family, your parents, someone that you can, that just disclosing and talk about your status already help you psychologically, and the support that you might get might play a big role. And then, of course, living positively also means that you have to prevent not to infect other people, prevention of transmission to others. And then, of course, nutrition plays a very important role. You have to eat very healthy as much as possible. And nutrition and HIV and positive living plays a very important role, because if you eat healthy, it builds your immune system and you become a healthy person. It gives you energy to do more. And then, of course, living positively also means to plan for your future. What do you want to have for your future? Many of you, or many of people, they want to have their own children, they want to have a bigger family, and this is where you have to, what the most important thing is, you have to adhere to your treatment. You have to keep to the principle of adherence, and then of course at the end of the day you have to have a healthy lifestyle. So you have to discuss that in your assignment. And then assignment number 7 is looking at the phases of the HIV infection. So the moment when the T cells is being infected by an HIV virus or the HIV, what are the different phases that the HIV virus is going through within your cell? And this is which you have to discuss, and I will actually recommend you that when you discuss each phase, you can also bring out the different phases that you can experience is when it goes from HIV to AIDS, when it becomes AIDS, when you reach the AIDS level. What phases are you going through the symptoms? So discuss this in detail, and of course you have to give some practical information. You have to give some practical information, and then you also need to discuss the relationship between the HIV infection and the ARV that you can use. And once you use ARV or you adhere to ARV, what role does ARV play when it comes to the HIV infection? Now I have given you there a picture that you can look at. Now you will see there from 1 to 5, it shows you, number 1, where the virus goes into your T cells, and then the moment it goes into the T cells, it infects it, and then it makes your cell a factory where it becomes where you produce some AIDS particles, and then you will see up to 4 where you release number 5 where those 8 particles are being released, and you can have up to 1 billion HIV particles in your body or in your bloodstream per day if you are not on ARV. That's why it's very important that you have to know your status as soon as possible to make sure that you are not going to make sure that the HIV does not spread in your bloodstream. So it's very important that you have to look into it. And in your assignment, you have to discuss this in detail with practical example and look at everything which is there. And then the last thing under assignment 7 is you can also look. Now this is just a guide that I can give you. The first thing that happened, normally the 3 stages, which is very internationally recognized, is number 1 is the infection stage. The second one is the latency stage, where the AIDS particle, where the HIV virus mutate within your T cells, and when we say latent, it can stay within your bloodstream for ages, or sometimes for 5 to 10 years without you knowing, and only after 10 years, when you don't go for HIV test, you can realize that you're HIV positive. And then the longer you stay without any treatment, and then you can reach the 3rd stage, which what we call the AIDS stage, where your CTV counts is way back below, and you become then very vulnerable for opportunistic infection. So those are the 3 main stages that you have. But in your research and your discussion, your analysis, you have to discuss this in detail with a practical example. So the last assignment 8 is looking about the PEP, or the PrEP, the post-exposure prophylaxis, which is very popular, especially in where people are working in a laboratory setting, and where they work with blood, and they can have a needle prick. Where people are actually exposed, like in a medical environment, where they can be at risk when it comes to HIV infection, like working with blood, especially in a hospital setting, laboratory, working with patients where they can be exposed. And this is something that the World Health Organization then also recommend, that when it comes to the employer, it needs to look at its PEP policies or about prophylaxis policies, especially when it comes to employees that are at a higher risk environment when it comes that they can be exposed. So the whole purpose of prophylaxis is to prevent the employee and to protect the employee not to be further exposed. And it's also a way to manage where accidental cases can occur and these employees are being exposed. So the other aspect is occupational exposure. As I say, you are working in a laboratory, you are working with needles, and you can have a needle prick, or you are working with blood and accidentally expose yourself with blood or any liquid from people that are HIV positive. And then, of course, the other thing which is very important is you must also discuss the legal framework of PEP or PrEP in Namibia. How does it work? Is there any legal framework in place? Then you must look at other sickness, of course, which are HIV related or co-infection like hepatitis B/C, which is also very fatal. And then, of course, you have to look at the different regimens that are in place or that can be used when it comes to prophylaxis. And then, of course, what are the universal precautions that you have to follow when it comes to PrEP. So that's my presentation, and I hope that it will help you and guide you with your assignments. So if you have any questions, I will encourage you to refer to your study guide, to refer to your study manual, or look on the internet, Google some of this information, which are free of charge. And I thank you for listening to me, and I wish you all the best with your assignment. Thank you.